All right, so next we have dilated cardiomyopathy. Actually, most common etiology is ischemic, and it's the most common to 50 to 75% of patients. Next up being hypertension and long-standing uncontrolled hypertension with secondary left ventricular hypertrophy, valvular as well, most common being mitral regurgitation, myocarditis, of course, one of the causes, and stress-induced or Takotsubo cardiomyopathy, tachyarrhythmia is long-standing AFib, infiltrative as well, as we discussed previously, HIV, drugs like cocaine, methamphetamine, alcohol as well is very common, chemotherapy, cirrhosis, pericardium, and genetic causes. So alcohol-induced, generally it's seen in patients who exceed 80 grams of alcohol a day over 5 years. So these are long-standing alcohol use disorder. Generally, alcohol is toxic directly to myocytes via oxygen-free radicals and creates defects in protein synthesis. So essentially, treatment is alcohol abstinence and appropriate heart failure GDMT therapy depending on their ejection fraction, and prognosis is better compared to other causes if patient remains abstinent from alcohol. And second, fairly common, the stress-induced or Takotsubo cardiomyopathy. The underlying mechanism is essentially a catecholamine surge from physical or emotional stress. Can also be secondary to coronary artery spasm or microvascular ACS, and typically it presents mimicking ACS with chest pain. It can also present with shortness of breath, shock, or syncope. And of course, if patients in shock presumed cardiogenic, an urgent transthoracic echocardiogram or point of care ultrasound is needed to assess for LVOT obstruction. And generally it's a diagnosis of exclusion, so you need all four, one being transient dysfunction of LV mid-segments or wall motion abnormalities extending beyond a single coronary distribution. 2 is ruling out ACS or obstructive CAD, generally via coronary catheterization. 3 being new ST elevation or T-wave inversions on ECG or increase in troponin, so one of the two, either ECG or troponin elevation. And 4 being the absence of FEO or myocarditis. Essentially, treatment is to remove stressor, ACE inhibitor, beta blockers, and essentially GDMT therapy, and most recover LV function in 1 to 4 weeks.